Welcome to Beating Cancer Daily. Beating stage 4 cancer for 30 years still takes my breath away every time I say it. I'm Saranne, founder of the Comedy Cures Foundation, and I hope you'll join me for just a few minutes daily for the next 365 days so we may laugh, learn, maybe cry a little as we live our best days beating cancer daily together. I wanted to talk about anemia today because I just remember hearing about it a lot when I was younger, and then they found out that I had anemia, and then there was some anemia when I was on years of cancer treatment. But I don't really hear people talk about anemia anymore. And I think it's an important conversation to have, especially if you are on cancer treatment or a survivor. And I love to mix humor into this. And I was thinking back to the days where they had me on iron supplements, and I wrote a joke, and then I found out that it's actually a mug, like a humorous mug that says, "The good thing about anemia is vampires don't want my blood." So you can even find humor in anemia. I couldn't have this conversation without my bestie. You love her. She's been on over 140 episodes of Beating Cancer Daily. You know who it is, Jacqui Bryan, a certified nutrition specialist, whole health educator, certified health coach, RN, and a multi-decade cancer survivor. Also, Jacqui Bryan, welcome.
Thank you, Saranne. And I think anemia is an awesome topic today because, as you shared, we don't talk a lot about it. It's often overlooked, yet it affects more than 2 billion people worldwide. I think it deserves a conversation, don't you?
And just think that's including cancer patients and survivors, but it really is something that can impact anyone. And I know you experienced it too when you were on chemotherapy.
Yes. Today we're going to be talking about anemia, and it's going to include cancer patients and even individuals that don't have cancer, right? And we're going to talk about what it is, what the common types are, how a person is treated. And then if someone is managing cancer treatment, what are some of the strategies they can do from a lifestyle nutritional standpoint to help support their body?
And if you're loving someone with cancer, any health challenge, or you're feeling a bit tired, I would definitely listen to this episode because Jacqui always has so many great suggestions for all of us.
And a lot of what we're going to talk about is not only treating our bodies with kindness to help improve our situation if we do have anemia, but also prevention, right? So, but it does help to understand what anemia is. And in its most basic description, anemia just basically means your blood isn't doing its main job really well. And the main job is to carry oxygen from your lungs to every single cell in your body. And if you imagine your red blood cells are delivery trucks, and each inside each one of those delivery trucks is a protein called hemoglobin. And hemoglobin is actually what binds to oxygen and hauls it around your body. And if you don't have enough red blood cells, or when the ones you actually have aren't working properly, your tissues start running on empty, right? They run low on oxygen, which means you're going to feel kind of crappy. And what are those symptoms you're going to experience? Fatigue. I'm not talking about the end of a work day feeling a little bit tired fatigue. I'm talking about bone deep exhaustion where you just feel like you cannot do another thing. Some individuals will have shortness of breath, pale or yellow skin, dizziness, lightheadedness, heart palpitations, headaches, cold feet, cold hands, difficulty concentrating. The list is pretty long, right? But what makes anemia really tricky, and this is what I really want to spotlight, it's not a single disease. It's a symptom.
Oh, Jack, I never thought of that, that it was a symptom for something bigger going on in the body. Wow.
Yeah, and so much of what I do with my clients is talking about their symptoms. When we talk about a symptom, we really want to understand what the root cause of the issue is. What I found fascinating in this research is that there's actually over 400 types of anemia, but they generally fall into three big categories. The first one is your body isn't making enough red blood cells. The second is your red blood cells are being destroyed faster than they're being made. And the third is you're losing blood. And the cause of the anemia actually determines the kind of treatment that you're going to get. So we're going to spend just a little bit of time talking about the different types of anemia so that we can understand the cause and the treatment.
I never realized it was this deep. I just remember being anemic as a kid, and they just made me eat liver all the time.
Oh.
That was that's it. You're anemic, eat liver.
Oh, it's funny. One of the most common types of anemia is iron deficiency anemia. And I'm going to bet that if you tuned into this podcast, that was probably what you were thinking, right? Oh, it's just a lack of iron. And by a wide margin, this iron deficiency anemia is the most popular. And really, iron's essential for making that hemoglobin that we talked about, the thing that's carrying around that oxygen. If you don't have iron and you don't have hemoglobin, hemoglobin is not going to work. It's not going to deliver the oxygen. And it's most commonly found in women of childbearing age due to their monthly blood loss, pregnant women who have their iron needs actually double during pregnancy, infants and young children that are just growing so fast you can't keep up with the iron. And then people that are on diets that are low in iron. And even those individuals that have chronic blood loss, which can include something as minor as an ulcer in your stomach or even as concerning as colon cancer, right? So the range is huge.
When you said that it often affects women, there was a cartoon with a middle-aged woman talking to her doctor, and her clothes are all crumpled up. And she says, iron deficiency. I bet that's why all my clothes are wrinkled.
Oh, you know what, Saranne? I have an iron deficiency myself.
But that's another podcast. Who has time to iron clothes anymore?
I know that's it. That would take us down a slippery slope if I start talking about my lack of ironing skills, right? But some of the common symptoms of iron deficiency anemia are brittle nails, hair loss, sore or swollen tongue, a strange craving called pica. And that's actually where people eat ice, dirt, clay, or starch. And that's because they're lacking in a nutrient. And so it could be a sign of low iron. So definitely something to pay attention to.
So anytime I go grab those potato chips, I could think, oh, that might be iron deficiency.
No, more if you start chewing on the wall like dirt or clay.
So if I go over to the potted plant and just decide to take a scoop of the soil, then I might have an iron.
Yeah, I
I'm
see
not
it.
trying to make fun of that. But you
Oh,
see
no.
kids eating dirt all the time.
And it's a sign. It's actually a sign that people should look for. There are vitamin deficiency anemias, vitamins such as B12 and folate. So if we think about our bone marrow, it needs more than just iron to make healthy red blood cells. It also needs B12 and folate. So without B12 and folate, the red blood cells are often too large. They become misshapen and they can function improperly. And they call this megaloblastic anemia. So when we're looking at vitamin deficiencies, if you have a B12 deficiency, it can come from a diet low in animal products. So think of vegans. Those individuals are particularly at risk. There's an autoimmune condition called pernicious anemia, which is where the body can't absorb B12 from food at all. And then even certain medications that include long-term use of metformin or even antacids that can affect B12 absorption and can lead to deficiency in individuals. When we're thinking about folate, that's often linked to a poor diet. We hear about folate deficiencies and why it's so important, especially in pregnancy. But people that use alcohol on a frequent basis, certain medications are some of the reasons why folic acid supplementation can be very important in this group. And so it is something that we want to think about. So one important note about B12 deficiency is it doesn't just affect the blood. B12 deficiency can cause nerve damage, leading to tingling in hands and feet. weight, balance problems, memory issues. So again, these B vitamins, which are B12 and folate, are incredibly important when it comes to not only anemia, but overall health and wellness.
And we have that great episode you did, Jackie, on the B vitamins. So I would definitely recommend that you go back and listen to that in companion with this episode.
It is. And I think, again, you and I talk about how miraculous the body is. And we think about all of these different conditions that are associated with not only the symptoms that we're experiencing, but nutrition. It's one of the reasons that I'm so passionate about it, right? If we think about aplastic anemia, this is another one that is rare, but it's serious. When someone has aplastic anemia, the bone marrow, which is really where the factory where your blood cells are produced, they stop producing enough of the new cells. So that means that not enough red blood cells exist, but also the white blood cells and platelets. So everything drops. And this is often caused from an autoimmune condition. And that's really where the immune system attacks the bone marrow. It can be caused by certain infections, exposure to toxic chemicals, radiation, some medications. In some cases of this type of anemia, the cause is never found. And the treatment for this is very complex. It can range from blood transfusions and medications to even a bone marrow transplant in severe cases. But this one is more rare, but I just wanted to mention it because it's in this family.
So it feels like this is something, if you're starting to see these symptoms mount, that you should reach out to your medical team. I did see a t-shirt that said, I'm not lazy, I'm anemic.
It's it's true though. You know what? That's so interesting you said that because that's one of the tips that I have for individuals that have anemia that the people around them need to understand. They're not being lazy. They actually have a condition that makes them chronically tired. But that's an excellent point, even though I know you said it in a funny way, but it is so true. It's so true.
And there's this funny play on an exam if you're going in for iron deficiency, where the doctor's holding a big old magnet and is going to see if you come towards the magnet or you have no metals. And it's
Oh,
not real. That's not how they test.
no.
But I thought it was a
No.
funny visual. Can
Yeah.
you
Oh
imagine
gosh.
if your doctor had
No,
a
I
sense of
can't.
humor and you walk in and the guy's holding a life-size U-shaped magnet and just saying, let me see if you have iron
That
deficiency?
would be terrifying.
Oh, it'd be
Terrifying.
hilarious. Oh, it'd be so hilarious.
Oh my gosh. We talked about different types of anemia so far. We covered the most common iron deficiency anemia. We talked about vitamin deficiency anemia, vitamin deficiencies with B12 and folate, aplastic anemia, which was more rare and serious. But then hemolytic anemias are ones that are really interesting, right? Because this is actually where the red blood cells are being destroyed, or we call them hemolyzed, faster than the bone marrow can actually make them. And this is actually an inherited or an acquired condition. These are ones that are found in sickle cell anemia patients. That's really where it's a genetic condition. It's most common in people in African, Mediterranean, Middle Eastern, and Indian descent. And that's where the red blood cells are actually shaped like a crescent or croissant or sickle instead of a smooth disc. And they're fragile, they clump together, they clog the vessels, they die early. It can cause episodes of severe pain and organ damage, and even more. And then another type of hemolytic anemia is thalassemia, which is another inherited blood disorder where the body makes abnormal hemoglobin. And so, talking about these types of hemolytic anemias are more just for education to understand it, because obviously you need to be under their care of a physician and people that are specialists in this field. But just understanding that these acquired hemolytic anemias can be triggered by autoimmune reactions, infections, certain medications, even mechanical heart valves that physically shred the blood cells, right? So there's lots of different ways that these anemias can occur in our body.
I have a comedian that works with us at the Comedy Cures Foundation, Nor Davis, and he has sickle cell and is open about it and has talked about it comedically on stage. And so, if you do have sickle cell or you're diagnosed with it, you might want to look him up, Nor Davis, and find some of his humor about living with sickle cell and being a working comedian.
Yes, it's so important to find people that you can connect with that are sharing a similar journey to you. I know that for me, being diagnosed with breast cancer 22 years ago, it was so helpful to connect with other survivors that were experiencing the same thing that I was. It made me feel not alone, but it also gave you a little tricks of the trade. What are some of the things that I need to do to help myself feel better? Another anemia that I want to talk about that is probably most pertinent to the community that you and I serve, Saranne, is the anemia of chronic disease, right? And this is really one that doesn't always get addressed. And I think it's so important for us to talk about. It's really when the body is dealing with long-term inflammation from conditions like rheumatoid arthritis, kidney disease, HIV, lupus, and inflammatory bowel disease, or even cancer. And it's really when the red blood cells become suppressed. And this is because of the inflammatory process. So the body essentially hoards iron, keeping it away from the bacteria and the cancer cells, but also unintentionally keeping it away from the red blood cells, right? And so this type of anemia is moderate. It doesn't have a dramatic low iron labs that you would expect to see when you're working with your provider. And it can be one of the most frustrating to treat because you have to address the underlying condition. And that's a little bit of a challenge, right? So if you think of your medical team more as detectives to figure out where this is occurring, to try to find ways to support your body, right? Because some people, if they are not skilled, they might just start throwing more iron at you, or they might start treating you for a different type of anemia. So it's very important for us to understand what is causing your anemia. And then one of the ones that we see frequently on TV or even in different settings where someone's losing a lot of blood is anemia from blood loss, right? So this is can be from an acute situation like surgery, trauma, or childbirth. It can be something that happens when someone has a slow bleeding ulcer, heavy periods, gastrointestinal tumor. This is when the body compensates for the slow loss of blood over time, which is one of the reasons that people don't always notice it until it becomes severe. So those are the range of the different types of anemia. And so I think it's important to understand the different types so that you don't just throw iron at everything, right? So we want to understand that there's different ways that we can treat it. But now I want to dive into how do we treat different types of anemia? What actually is done for these individuals?
Jackie, you just brought up such an amazing point, and I think that's why we have to be advocates for ourselves, and you have to trust your gut because this could be pushed off as one thing when there's really an underlying cause. And I've seen that so many times, especially with women, especially with minority women, where the doctors just don't realize that your system could be operating differently than the other 20 people that they just saw. And so I'm really about empowering the voice of patients. And it's not that they're being rude, it's that they have maybe 10 minutes to talk to us. And the research studies have been on white males, say, and they don't have the stats for women or minorities. And so you might have to push a little bit as your own advocate. You might have to do some research so that you could come in with some studies that show that maybe your population of people is impacted differently. And again, it's not that somebody's trying to be rude. It's just that when they went through medical school, that research wasn't there.
Yeah, and I think that's a really good point, Saranne, is being your own advocate, but also I love keeping a symptom journal, right? Because then when you go to the hospital or to the doctor, you can say, here are my symptoms for the last couple of weeks. And I thought this would help give you some more information so at least they'll know what to test for. Because now that we just reviewed all the different types of anemia, the core principle behind the treatment is to treat the cause, not the number that's on the lab, right? We need to understand what is going on. So if we have iron deficiency anemia, this is often treated with iron supplementation, usually oral iron pills, although sometimes they cause side effects like constipation and upset stomach. We do know that taking iron with vitamin C, that's a key. Put a little star next to it. Take iron with vitamin C is going to improve absorption. And sometimes IV iron is used when the oral iron is not necessarily working or well tolerated. And so you can include just early on your own iron-rich foods, things like red meat, leafy greens, spinach, lentils, beans, tofus, fortified cereals, and pumpkin seeds. There you go, Saran.
Yay. We have to talk about pumpkin seeds every episode that Jackie's on, or it just really isn't an episode because these are little superpower ideas. I really never thought of them until we started this podcast, and Jackie just has us all eating them all the time. And she doesn't
As
own a
long as you're not
pumpkin
allergic.
seed. Yeah, as long as you're, and she doesn't own a pumpkin seed plant or anything like that, but she really loves that we have them daily.
Yeah, I do enjoy them. And they're not for everybody, but they have a lot of wonderful nutrition in them. And another thought about iron-rich foods is, as we mentioned, pairing it with vitamin C, but also avoiding coffee and tea with meals, because we know that avoiding those can actually help with better absorption of iron, which people often are surprised by that information.
Wow, I didn't know that. So thanks, Jack.
Yeah, we want to think about making your body as efficient as possible. And sometimes that means pairing the right foods together, right? So if we're thinking about vitamin B12 deficiency, when we talked about those vitamin deficiency anemias, those are often treated with B12 supplements, either orally, under the tongue, or by injection. People with that pernicious anemia often need injections for life because their gut just can't absorb B12 at all. Those people that have a folate deficiency, that's straightforward, right? This is where we have just folate supplements, usually combined with dietary improvements. We talked about the aplastic anemia. The treatment really depends on the severity. Remember, this was a little bit more rare. In those mild cases, they can be managed with blood transfusions and growth factors, but severe cases may need immunosuppressive therapy or even a bone marrow transplant. This is how severe anemia can get.
Yeah, I remember taking a friend for infusions quite often, and it really helped her. But before they diagnosed what was wrong, she was so debilitated.
Yeah, and these can be very debilitating conditions. We talked about sickle cell anemia earlier, and you shared the story of your friend that is very open about managing sickle cell, right? But we know that management of sickle cell is often done during the crisis, right? Sometimes they'll use hydroxyurea, which is a medication that reduces that sickling effect, the change in the shape of the cell, blood transfusions, and in some cases, that bone marrow transplant. Gene therapy is something that's new and emerging in this field, and it's really very promising in sickle cell treatment. But again, those are very serious conditions. And we know that this type of anemia can improve when we treat that underlying condition. Erythropoiesis stimulating agents are medications that signal the bone marrow to produce more red blood cells. And these are sometimes used. I know they used one on me when I was having a certain type of chemotherapy agent that was suppressing my production. And so they use that in order to increase red blood cell production. Iron supplementation with this population may also help if the labs show that you are truly deficient in iron. And again, this is a partnership with your providers so that they are the ones that are going to determine the next step or the next treatment for you. This podcast is more the conversation starter to get to understand anemia, but the treatments really need to be driven by your provider.
We are always about it's a team, right? We should not be going this alone. You should not just be doing this with someone that's caring for you. You have to really be in dialogue with your medical team if you are going through cancer treatment, survivorship. These things can turn nasty fast. And so if you are suspecting anything, let's just get you back in front of your medical team.
Yes, so, so important, right? We were talking about all the different types of anemia, and this is where you, as a partner in your own healthcare journey, need to talk to your provider about those things. And as Saranne suggested, don't wait around, get it checked. The one that we mentioned at the end of all the long list of the different types of anemias is blood loss anemia. And really, the fix for that is to find and stop the source of the bleeding, replenishing the iron. And in severe cases, some people will need a transfusion. And so, those are just some recommendations for treatment. But what if you have anemia and you're a cancer patient? What are we supposed to do? And that's really where I wanted to finish off today, because I know that when we're going through treatment, we have to think about so many different things, the surgeries, the medications. What is this doing to my lifestyle? And if you are someone that's going through chemo or radiation, there's a good chance anemia has come up or will come up. And so there's certain things that we can do to support the body.
I wish I'd had you, Jackie, when I was going through my cancer treatment. I just had to do so much research to make sure that every organ was staying healthy, that I was eating the right way, that I wasn't letting that anemia get out of control. It was so much work. And now you just bring us so many great ideas so that we can keep ourselves safe and in communication with our team. And I really appreciate it.
I think knowledge is power. And I think that's what you and I are doing with this podcast. If you think about those chemotherapeutic drugs that you and I got, Saranne, those are designed to attack rapidly dividing cells, those cancer cells. But stem cells in the bone marrow are also rapidly dividing. And because the body constantly needs fresh new blood cells, chemotherapy often hits the bone marrow really hard and causes damage. And it can slow down the red blood cell production. And this is often called chemotherapy-induced anemia. And so there are some drugs that are more culprits than others, things like the cisplatin or the carboplatin family. Radiation to the bones is also an issue in terms of bone marrow production. So it's something that we need to stay on top of to support the body. Now, your oncology team is going to understand that this is an area that they need to pay attention to. But you can certainly be a player in explaining what your symptoms are to give them a cue, to give them an idea of what's actually going on with you.
The drugs that you mentioned are just such first line drugs. They are workhorses in so many kinds of cancer. So if you are taking the path of chemotherapy and or radiation, these are things that could potentially save your life. What Jackie's really talking about and what our study together really focused on is how do you mitigate the collateral damage? So if we're going to do these things and we know that they could potentially have these side effects, let's get ahead of it. Let's really stay ahead of this. There was a good cartoon with Snow White. She was laying down when she's in that deep sleep, and the two dwarves are talking, and one dwarf says to the other, they think it's anemia. What a clever play on Snow White and the Seven Dwarfs. But it's true. We have to be detectives with our team. And we have to really be thinking about our other organ health while we are going through any kind of medical treatment, even if it's not for cancer. How is this drug affecting this part of my body? And what can I do so that I can take this drug, but also stay as healthy as possible? This is the whole reason why I think I have stayed so healthy for decades after all of my treatment for stage 4 cancer.
It's so important to understand that. And your medical team is going to know to be on the lookout for these things. But again, understanding that some of the anemias are caused not just by the medication, but it can actually be caused by the cancer itself. So, especially for blood cancers like leukemia, lymphoma, those types of cancers can actually crowd out normal blood cell production. And many cancer patients have anemia of chronic disease on top of this, right? Because those cancer cells are crowding out the cells that we need in order to get oxygen to our organs. And the result from all of these things we've talked about is the patient, you feel absolutely wiped out. It's not the kind of wiped out, oh, I just need a nap. It's more like I can't lift my arm. I need help. I can't even get to the bathroom myself. The world feels gray. I don't even recognize myself. I am so tired. And this is what we call cancer-related fatigue. And anemia is one of the biggest drivers of this experience. And so if you love someone that is going through cancer treatment and you want to support them, especially if they have anemia, then understanding all of these things can be really helpful. Understanding that we need to respect their fatigue and not fight it. I think that's a big one. They're not lazy, right?
Jacqui, do you remember that feeling? Because I remember lying down on the floor and feeling like I couldn't move my arms. And I am such an energetic, high octane person. And it felt like someone just pulled the plug out. Now, that can also be caused by different kinds of depression or chemical imbalances, but I'm talking about identifying with that cancer anemic fatigue. It was intense.
It was mind blowing. I tried to explain it to somebody as taking the tired you feel when I was pregnant and multiplying it times 10 because it was just the strangest feeling. And especially, I love the high octane comments, Saranne, for you because it's so true. You're high octane, baby. But I'm also high octane too. So I know that feeling it's really difficult to describe. So if you're supporting
You just channel your competitive octane into competitive sports, and I channel mine into talking. That's it.
I think, Saranne, you just help the world. You don't just help, you just don't help people in our country, you help the world. So, way more than what you just said. And I'm going to guess that every listener out there is going to agree with me because you're pretty extraordinary.
Thank you. I'm just excited that we are in 149 countries and that we've done over 430 plus episodes and we're still going strong. Just as long as you guys keep listening, we're going to keep talking. So that is my high octane superpower.
It is. It's amazing. So, if you're helping somebody with anemia, especially if they're in cancer treatment, offer specific help, not just open offers. Hey, I'm here if you need me sometime. How about if I go to the grocery store on Tuesday for you and I'll pick up some yogurt for you, whatever specifically they need. Help with the energy draining tasks. Those are things like yard work or cleaning or kitchen work. Be calm and be a low demand presence, right? I think you don't want to be demanding too much from them and learn the warning signs that they may need medical attention. And then just to highlight what I am really focused on, which is their nutrition, right? Understand that nutrition is going to make a big difference. The small, frequent meals, foods that are easy to eat, not just easy to cook, but just easy to eat, and understanding that you can sneak those things in, right? So if iron is what we're needing in this individual, which may often be the case, understand the difference between the two kinds of iron, like heme, which comes from meat, is going to be about 15 to 35% more absorbed than non-heme iron. And that's going to be coming from plants. They're both good, but they don't have the same absorption rate. Right. So those are things that we can do to think, oh, if I'm going food shopping for this person that I love, I'm going to pick up maybe a little bit of dark poultry meat, or I'm going to bring in some non-heme iron and lentils and chickpeas and white beans, right?
Spinach. We all think spinach.
I know spinach is a non-heme iron, which is great, but just keep in mind that if someone is really needing to get iron in their diet, And it's not that it's a bad thing, but non-heme iron that comes from plants is absorbed at a lower rate, at about 2 to 20%, versus the animal protein, which is absorbed 15 to 35%. So it's good to have a mix of those things. I think another thing for us to think about with bringing iron into our diet is to make sure vitamin C is there, right? So we want to pair iron-rich foods with vitamin C. Squeeze lemon over your lentil soup, eat your spinach with strawberries or orange slices, have a glass of orange juice if you need with an iron supplement. Those are actually going to be very beneficial. And as we mentioned earlier, that we want to avoid the foods that are going to rob the iron or compete in the body for spaces to absorb the iron. So coffee and tea, if you're having those at the same time as iron, that's probably going to block absorption. So you want to wait at least an hour after your iron-rich meal. That can be really helpful as well.
I never knew that about the sea. That is so interesting. And I don't eat a lot of red meat, either does my daughter. But when I see her looking a bit pale and she's moving slower than she does, she's a high octane person too. I always say, "Can I buy you a steak? I want to buy you a steak." And I don't know if this is a placebo or not, but I watch the color come back into her face. I
It's
really do.
interesting. Yeah, nutrition is fascinating. Think about those people that are super focused on calcium, right? So we need to get calcium into our bones, and those dairy products and calcium supplements can actually compete with iron for absorption. So you don't want to take them at the same time. I think about those people that are popping all their supplements at once in the morning, and we know that they're actually competing. Even the high phytate foods, the foods like whole grains, legumes, nuts, they have phytates that can actually reduce the non-heme iron absorption. So that's one of the reasons I say, hey, let's have sprouted pumpkin seeds, or let's soak our nuts, or let's ferment these foods because it's going to reduce the phytates that are actually present. And you can learn more about that in the anti-nutrient episode that we did.
Yeah, I forgot about that too. Wow. It's interesting because you have to consider what you're eating when you take your vitamins. And I know some vitamins you take with food, some you're better if you take them with something a little fat based, like an avocado, but it even means that we need to be thinking about how we're mixing and pairing things. And I
It does.
really don't think about it. I do for calcium, but I haven't in terms of iron.
A lot of people are popping antacids because they have an upset stomach. And what they don't realize is that these antacids reduce stomach acid, which is actually needed to absorb iron. So if you don't have the acid in your stomach to absorb the iron, then that's going to be somewhat problematic as well. So another way for us to get B12 in food sources is to just be aware of where we can sneak it in through things like clams and oysters, beef liver, salmon, eggs, and dairy, even nutritional yeast. That's a great options for vegans because that will give you many of your B vitamins and some of the fortified plant milks and cereals. Folate is one that we think about. We need to take maybe a supplementation of folate when we're pregnant because it's critical for that blood cell production. But you can also get folate in those leafy greens, the spinach that Saranne was talking about earlier, Brussels sprouts, avocado, beets, oranges, orange juice. There's lots of different ways that we can get those in our body, right? So we highlighted today all the different types of anemias. We talked about what are some of the treatment strategies for these. And then we had a special consideration for cancer patients, those small, frequent meals, focusing on protein, iron-rich foods that we were just talking about. But I really think it's important for us to understand what the underlying cause of the anemia is before we actually go full throttle on treating it because we need help. We need to have someone on our medical team to guide us as to what is the best way to address the root cause of this issue.
So, can we just highlight some of the warning signs? Because I want to make sure that we're clear of some of the things we could be looking for.
Yeah, that's a great way to finish off today. One is we need to look at fatigue, right? Not regular tired, but that bone deep exhaustion shortness of breath, especially with activity, pale or yellow skin, dizziness or lightheadedness, heart palpitations. You got to remember your heart is working overtime to try to compensate. Headaches, cold feet and hands, difficulty concentrating. We call that brain fog, right? I think it's important to understand that anemia isn't simple. It wears a lot of faces. It can be that teenager whose iron is low because she's not eating enough red meat. It could be an elderly man with aplastic anemia, or it could be a parent that's going through their sixth round of chemotherapy wondering why they can't get off the couch, right? We know that there's a broad range of issues here, and we need to be able to connect with our providers to help us uncover the root cause. And you can participate in your care by sharing with them your symptoms and keeping track of what you're doing, maybe even what you're eating as well.
I love this. I feel like I'm a mini expert on anemia now. I'm going to be looking at people wondering, do they have anemia? But this was so comprehensive, Jacqui. And I saw a t-shirt that made me laugh that said, I'm too anemic for this. If you are dealing with anemia, you have to get that t-shirt because that would be a really fun way to signal to people, not today. I need to rest and do some of the recommendations that Jacqui said and reach out to your medical team and see how else they can help you. So this was fabulous. Thank you so much, Jacqui. I really appreciated it.
Thank you, Saranne. This was your masterclass in anemia.
Definitely. This whole podcast is a master class with you, but this really was a master class. I think I'm going to have to listen to it a couple of times.
Have a great day. Thanks so much for having me.
Yes, sweetie. So if you want to write to us, just go to comedycures.org. If you want to record a message to us, go to the podcast section and hit the record button. We'd love to know, has this opened your eyes and helped you verbalize to your doctor what you're feeling? And did you discover that you may have some anemia? Do you love someone with anemia? Jacqui Bryan is amazing, and you can reach her at jacquibryan.com. If you can't find her, then just come back to me at the Comedy Cures Foundation, comedycures.org, and I will send you her signature. Have a blessed day, and I'll see you tomorrow. If you loved today's episode, then tell the world. Why? Because Beating Cancer Daily is a listener and donor supported experience. So the more people you tell and the more people that join us, the more robust and interesting programs our nonprofit, the Comedy Cures Foundation, can bring to you throughout the year. So if you have some extra change, I'd love you to go to comedycures.org and make a donation today of whatever level is comfortable for you. And it will be tax deductible to the extent allowed by law, because Comedy Cures is a nonprofit 501c3 organization founded from my chemo chair, April 1999, and we've been going strong ever since. So please consider making a donation today and help our community and this podcast thrive. Guess what time it is? It's time for me to read the disclaimer. Beating Cancer Daily and the membership circle are not in lieu of medical advice or treatment. They are for entertainment purposes only. Please consult your healthcare team to review your best strategy. Thanks for listening. See you guys tomorrow.